Hello, I'm Dr. Campbell from the Priory Hospital. Stress can affect anyone at any level of society. The main causes of stress among patients we see at the Priory are stress at work, taking on too much work, volume of work, deadlines, marital stress, money, physical illness, and drinking. Patients often present with both physical and psychological symptoms. Physical symptoms such as palpitations, shortness of breath, stomach symptoms, and psychological symptoms such as feelings of continual background anxiety. As a patient said to me the other day, it's as if I'm in a taxi on the way to the airport and I'm late all the time. They can't concentrate, they can't sleep, they become irritable, they become snappy, and their overall functioning, both in relationships with other people and at work, becomes poor. Many patients present after a long time of living extremely stressful situations and becoming extremely exhausted, effectively what we call burnout, which may require a short admission to hospital for more acute treatment. What the Priory hospitals offer is rapid assessment by an experienced psychiatrist and follow-up with that psychiatrist. He is likely to recommend an experienced therapist who you would see for 6 to 12 sessions, perhaps longer, and he may recommend medication which he would monitor the dose and the length of prescribing. Patients who are extremely stressed cannot function in any aspect of their life. Stress is treatable. The first thing is for the patient to recognize there's something wrong, and then something can be done about it. Typically, treatment for stress with an experienced psychotherapist will be 6 to 12 sessions over 3 to 4 months. And patients will notice a significant improvement in the first few sessions. It's often identifying you've got a problem and knowing that you're doing something about it instead of just worrying about it is extremely effective. In my experience, almost all the patients whom I see who engage in treatment will feel much better within 3 to 4 months. In order to avoid stress, so much stress these days that we see is related to work. So a work-life balance is extremely important, but also to negotiate with employers what is doable in your job in terms of volume of work and time and what's expected of you and what's realistic. Also, healthy diet, exercise, and not drinking excessively. One of the most important things that patients that do therapy in Priory hospitals, either individual or group therapy, learn is about assertiveness, particularly in regard to work, and being able to say to employers and HR departments, this is what I'm able to do and this will keep me well in the future. Priory hospitals offer individual and group psychotherapy. Group psychotherapy is particularly effective with patients who have difficulties with interpersonal relationships, phobias, and assertiveness.